Okay, good morning. We're going to be going over the cardiac anatomy today. So just starting out externally, the four chambers of the heart, the right ventricle, right atrium, right ventricle, left ventricle. Each atrium has an ear-like appendage called the auricle, each atrium. Okay, now we're going to follow the heart in the manner that blood would flow through the heart. So blood enters the heart into the right atrium through the superior vena cava, draining the head and arms, and the inferior vena cava, draining the lower portion of the body. Okay, draining into the right atrium. Now each atrium on its anterior surface have ridges of muscles. These ridges of muscles are called pectinate muscles. Inside the atrium there's a structure that's a remnant from fetal circulation called the fossa ovalis. It's a shunt between the right and left heart in fetal development. Okay. Here you see the openings from the superior vena cava, inferior vena cava, and coronary sinus. So after blood enters the right atrium, it's going to go through the right atrioventricular valve into the right ventricle, also called the tricuspid valve. Now inside the ventricle there are ridges and valleys of muscles that are called the trabeculae carni, both ventricles. Specific ridges that attach to the chordae tendineae of the valves are called papillary muscles. Okay. Leading out of the right ventricle is the exit is through the pulmonary valve, and this leads into the pulmonary trunk, which carries deoxygenated blood to the lungs. The pulmonary trunk divides into the left and right pulmonary arteries. So that will go to the lungs and then come back through the pulmonary veins, carrying oxygenated blood back to the left side of the heart. So now inside the left atrium, again the pectinate muscles, okay, and then the valve between the left atrium and ventricle is the left AV valve, also known as the mitral valve. Again, trabeculae carni. Here you can see this septum, or the wall between the right and left ventricle, the interventricular septum. There's also an interatrial septum between the two atria. So these are like walls between the rooms of the heart. Now, the exit out of the heart, the left ventricle, is the left aortic valve, which lies a little posterior medial to the AV valve. It's kind of hard to see, but tucked up under there. And then blood will come out the aortic valve into the aorta. The first portion of the aorta is the ascending aorta, and then the arch, and then the descending aorta. Okay. Now there's a structure here, a whitish structure, that's also a remnant of fetal circulation. It's called the ligamentum arteriosum. This represents another shunt between the right and left side of the circulation in fetal development. Now branches off the aortic arch, the first three branches, the B, C, S branches, the brachiocephalic artery or trunk, will divide into the subclavian and carotid, the left common carotid, and the left subclavian. Okay. Now looking at the surface of the heart to go over the coronary circulation, okay, there's two main coronary arteries, the right and the left. They're the first branches off the aorta after it comes out of the left ventricle. The right coronary comes down along the right ventricle, gives off a few branches. These are called the marginal arteries, and then it continues to the back. The left coronary artery comes off behind the pulmonary trunk, emerges. Just after it emerges, it splits into two main arteries, the left anterior descending, or LAD, also known as the interventricular artery. The circumflex then goes circumferentially around the heart to the back. So those are the main arteries of the front anterior portion of the heart. Now in the back, the main artery in the back is the posterior interventricular coronary artery, or the pica, P-I-C-A. Now all the arteries have corresponding veins that run with them that drain the arterial circulation. So the veins that drain the circulation from the marginal arteries are called the anterior cardiac veins. The veins that run along with the left anterior descending and circumflex artery This is entirely the great cardiac vein. So it starts here and goes all the way up and around. And then posteriorly in the heart, a vein that runs along with the pica artery is the middle cardiac vein. And then all the veins coalesce and come together in a structure called the coronary sinus, which will then empty into the right atrium. Okay, and that's it for the heart.